haven't, it's worth looking at. This is the factors that influence health, and the largest impact being at these socioeconomic factors. So that's poverty, education, housing, and equity. We tend to put all our energy up here developing programs, but really this has the biggest impact. Changing the context to make default decisions healthy is the next contact. And so if you want to think about that the ascending impact on that. Interventions at that lower level tend to be more effective because they reach broader segments of the society and require less individual efforts. Any of you who have tried to buy an 8-ounce Coke at a grocery store lately will know that that has gone from 8 to 12 to 16, and now if you can find anything less than a 20-ounce bottle of soda in a convenience market or a gas station when you're stopping on the road, that's the kind of systemic change that seeps into our life, and pretty soon we're drinking a 20-ounce bottle of soda rather than a 6-ounce. So our particular efforts are focused on a media campaign around food, drink, public transportation, bicycling, and walking, increased access to healthy food availability. We're working with our school districts. They are actually trying to re-implement physical education in some of their programs. We're dealing with the placement of food products in the vending machines, putting healthy food in vending, so creating policy in our sister organizations or our partner organizations where they're going to do those kinds of, as I said, healthy foods in vending machines, safe routes to schools, and then at the with our low-income housing leadership network will be a focus for some of this local government policy where we're talking about complete streets, planning and zoning, increased signage, etc. Our other service delivery, tracking Candace's, is diabetic equity. And again, this was serendipitous when our medical home provider, we had a medical home route as part of our health and behavioral health leadership network, and we asked the medical homes what was the biggest problem that they had, and universally they said the lack of access to specialty care. We had a little bit of money. It was a $1.2 million, and we said, what can we do? If we only had that much, what could we do? We picked diabetes, junk, and then the $1.2 million went away because of the budget crunch, but everybody was invested in the process. So they stayed at the table and they said, with our existing resources, what can we do? We found a private foundation that was looking to do screening and outreach. And so we're doing actually a study with them. They wanted to identify 100 clients to see if they could make a difference. So they do the screening. They do the screening. They had community health workers that were doing. They're doing a motivational assessment, and then they'll follow up with care with people. Our free clinics, federally qualified health centers in the health department, are using their resources to do testing, education, disease management, etc. And on the specialized services, we consolidated those. Everybody was fighting over volunteer specialists, and we said, let's stop fighting with each other. Let's try to work together to get people to volunteer. And so the health department centralized that. They also offered up their management information system so we could track clients, and they provide dental. And lastly, this is my vision of where we are. We're really this is the, if you've seen it, this is planogram. This is the evolutionary tree of life, and that's sort of my metaphor for where we are today with healthcare reform. We think it has the potential to have make a major difference in the lives of people in Pinellas County, and we're trying to adapt to that change, as information comes out. But it's painful. There are going to be winners and losers here in the system. There's a lot of anxiety on the behalf of providers. Everybody's trying to figure out, it's like, are you an accountable care organization? Am I an accountable care organization? What is an accountable care organization? people are trying to position themselves wherever they can. And in the meantime, it's rolling forward. So, you know, we know at the end of the day what we want. As a network, what we know is that we want improved access, improved quality, and reduced cost. We don't know where we're going to end up on this. We hope we end up here, but we don't know. But we do think that because of the structure of our network and because of the broad group of stakeholders that we have involved from our community in the work that we're doing, that, as Candace says, we think we're well positioned to adapt to whatever comes out, either through political action or through redesign of our own system. Did I make it? A little over.